Hello everyone, it's Schematic Med, and today let's talk about the blood pressure targets in ischemic stroke. First, when administering thrombolytics, we always measure the patient's blood pressure beforehand. It must be 185 over 110 millimeters of mercury. If the blood pressure is elevated, we first need to lower it before administering systemic thrombolytics. After giving medication such as TPA, tissue plasminogen activator, we must closely monitor and control the blood pressure. It should remain below 180 over 105 millimeters of mercury for the next 24 hours. As you can see, the target blood pressure is slightly lower after thrombolysis, with systolic reduced by 5 millimeters of mercury and diastolic by 5 millimeters of mercury. Maintaining these levels is crucial to ensure patient safety. Now, what should we do if we cannot administer thrombolytics? This occurs when the patient presents more than 4.5 hours after symptom onset or when there are contraindications to thrombolysis. In such cases, we allow permissive hypertension. This means we permit systolic blood pressure to be less than 220 millimeters of mercury and diastolic blood pressure to be less than 120 millimeters of mercury. However, when blood pressure is extremely high, when systolic blood pressure is higher than 220 or diastolic is higher than 120 millimeters of mercury, we need to lower it carefully. The recommended approach is to reduce blood pressure by 15% within the first 24 hours. Abrupt reductions should be avoided as they can lead to further complications. For example, if systolic pressure is 220, a 50% reduction would be approximately 33 millimeters of mercury, bringing the target to 187 in the first 24 hours. Similarly, if the diastolic pressure is 120, it should be reduced to around 102 within the first 24 hours. Thank you, bye.